Good morning and welcome to Building Better Healthcare in conversation with KwickScreen. I'm Jo Makasinski, editor of Building Better Healthcare, and today I'm talking to Alan Murrell, Chief Executive of KwickScreen. Good morning, Alan.
Good morning, Jane. How you doing?
I'm very good, thank you. Can you start by telling us a little bit about KwickScreen and its work within healthcare, please?
Yeah, of course. So KwickScreen started as a project funded by the Department of Health back in 2009, and we were looking at how can you improve infection isolation protocols within hospitals. MRSA was the thing that was on the news at the time, and it was about, can you create a healthcare environment that is more hygienic than those that we have at the moment in our ward-based system. So over the last 10 years, we've been developing products that allow us to create more flexible, more hygienic, more sustainable spaces with our range of screens that you can see behind me that can help brighten up hospitals all over the world and create cleaner spaces.
So what's the main challenge you're trying to solve within healthcare?
So the main challenge that we have is really trying to disrupt the status quo. So if you look at a picture of a hospital from 100 years ago and a picture of a hospital today, there are many differences, but one striking similarity, and that is curtains. 100 years ago, we were still hanging bits of cloth between beds as the thing that we chose to have for privacy. It was convenient, it was easy, it worked in that world. And whilst everything else has evolved, the cast iron bed is now replaced by a bed that can adapt and evolve and support the patient better. The chairs have changed, everything has changed. We still have bits of fabric between patients. And there's numerous studies have shown that the curtain is often one of the most contaminated things within the hospital. It's often the sixth most contaminated, but the only thing that's not cleaned between every patient. And we believe that actually today we can design spaces and products that help hospitals stay cleaner and more hygienic, and means that the patient has a better chance of not acquiring a healthcare-acquired infection. And we think that's the number one challenge. People want to go to hospital and they should expect to go in and they expect not to be more sick. They expect to, they have a guarantee of a clean space. And that's something that's really hard to achieve with a curtain. Whereas the KwickScreen allows you to create those spaces.
Tell us a bit about how KwickScreen actually works and how it stops this infection spread.
Yeah, so the KwickScreen is not a sealed room, so it's not like a negative pressure room where you would have for someone who's got airborne pathogens. The main thing about KwickScreen is that it's an easy to clean screen. So it's used from the handle, which means it's got a touch point. So it's used up here. And so if you're cleaning that as part of your daily cleaning routine, you're able to keep a much cleaner ward environment. The main thing is it helps manage the spread of droplets. So if someone's coughing, spitting, talking, that droplet transmission is reduced because it's caught on the screen. Same as a curtain, but the big difference is you can clean this without disposing of it or laundering it. The majority of our customers will wipe it down, they'll use hydrogen peroxide, bleaches, UV light. So in that sense, it becomes a much more sustainable alternative to curtains as well.
Moving forward, how do you see the design of healthcare environments changing and this product sort of working within that change?
So I think one of the trends that we're seeing overwhelmingly in healthcare, not just here in the UK, but globally, is a real demand for flexibility. I think the last few years of the pandemic have shown that we have to build healthcare spaces that can be adaptable, can be flexible, can cope with whatever might come through the door. And traditional ways of delineating space like curtains are limited. They're fixed in position, and you have to change them, which means if you have a surge of patients of something infectious like COVID, your costs spiral quite quickly. Now, I'm actually standing here between our original product here, the single screen that goes between beds and is quite good for situational screening, but also on my left are our new products, and these are designed to go all the way around the patient bed. And that allows you to create spaces that you otherwise wouldn't have been able to. It means that you can replace a curtain as it's a solution that can provide privacy, but it gives the patient that feeling of being in a room. But it retains the flexibility that the screen on my right started. And so that's, I think, over the next few years, we're going to see more and more healthcare facilities demanding that their spaces are more flexible, patients demanding that infection control is better, because no one should get sick by going into a hospital. And then also we're seeing more and more government-led initiatives saying that actually we've got to be more sustainable as well. So curtains that are single use, which is what we have primarily in the UK, or laundered, which is what we have normally in the US, they really fall down on both the infection control and sustainability side. And then also, of course, the flexibility is where products like these that roll in, roll out, can be repositioned, can make an enormous difference.
Thank you very much, Alan from KwickScreen, for talking to us today at Building Better Healthcare. If you want to see any more of our video interviews, please head to our YouTube channel and hit subscribe, or visit www.buildingbetterhealthcare.com. Thank you very much.